Good morning, sir. Good morning. Good morning, sir. Good morning, sir.
So you feel that there is no disadvantage for persons who are not able to afford coaching classes?
Sir, there is in any competitive exam, I believe there is an element of coaching as well, which has obviously helped every student. And similar is the case in NEET, like me being a student who has seen NEET as well. So I do feel that there is an element of coaching that definitely helps propel a student to win in this rat race. And that being the case, our state government as well has promulgated a scheme, be it the non-Mudalvan scheme for competitive exams, which again trains students for NEET and JEE and also for other competitive exams, by which the state has taken up the initiative of training the students so that everyone can step into the last mile, and even every single student at the last line will be able to make it to the final cross line.
Okay, good.
You have a very impressive resume, and I see you what polyglot with Indian languages. How many languages do you know?
Ma'am, I know 4 languages like fluently, which is English, Hindi, Tamil, and Malayalam. Telugu, like I know partly, ma'am. So
You can read.
I won't be able to read, but I'll be able to understand and speak a few lines, ma'am.
Okay. And swimming, all 4 strokes, so what are those strokes?
Ma'am, swimming has 4 basic strokes. One being the breaststroke, which is the normal swimming that we see people do. And the second one is the backstroke. Backstroke is when we lie flat and propel using a cycling mechanism. The third is the freestyle. Freestyle is what we try to propel the water behind us, as in backwards through our forward motion of our hands. And the fourth one is the butterfly stroke, which is more in the terms of a butterfly, which propels us towards the end line.
You've participated in any?
Ma'am, I used to do swimming since 4 years of age. Like my mom put me into swimming. But then I've not got into competitive events into swimming, ma'am. We used to do it more like a leisurely activity.
Do you still go for swimming?
Yes, ma'am. I do still go for swimming.
And what is this NCCC certificate?
Ma'am, the NCC again has A, B, and C certificates. A certificate is given at the end of the schooling, as in when we participated since class 8. And then we have a B certificate and a C certificate, which is awarded based on the camps and the exams that we pursue in our college. So C certificate is the maximum possible. And again, that is graded as A, B, C, based on the grades and the marks that we get in our exams.
Do you have a passion towards medicine?
Ma'am, yes, undoubtedly I have a passion towards medicine, and that has brought me into the medical field, be it for my UG MBBS career. I would attribute it more towards my family, which has been the main reason for me pursuing my MBBS, because my dad passed away due to cancer when I was in class 12, and that was a big setback for me and a big blow when I understood how the medical field works and how probably I should be learning medicine as a career, not just to save other patients, but as well help them in getting appropriate treatment, which would probably be the need of the hour. Like my dad could have probably been saved had I been a medico back then, or had I recognized the symptoms of cancer at the right moment. And even during my MBBS, my mother still developed cancer, and again, my grandmother as well, my maternal grandmother again developed cancer, and she passed away as well in 2020. So having a strong family history of cancer, I felt that I needed to pursue medicine in order to find out the symptoms as early as possible.
Then why do you want to switch into the administrative service?
Ma'am, again in MBBS, like when I've been pursuing, especially in my internship, I saw a multitude of patients being treated by the PMJAY and the CMCHIS schemes, which are the Pradhan Mantri Jan Arogya Yojana and the Chief Minister's Health Insurance Scheme. So this scheme has been instrumental in helping patients, even even not just simple procedures, say, which would take probably 1 lakh or so, but even liver transplants and renal transplants, which are worth 40 or 50 lakhs in the private hospitals, have been done free of cost at the government hospitals. And that has been instrumental only through such schemes. So if I were a doctor, I would probably be able to see patients, maybe 80 patients a day, and probably save on an average into 2,400 patients. But through such schemes, I will be able to devise and help and save the lives of probably 1 million more patients across a month span. So I felt that I will be able to cater to a larger population, and the diversity that it offers, I felt that the civil services would be apt, ma'am.
Okay, what are the challenges in the health, currently in the health scenario which India is facing, and what steps has the country taken towards, rectifying the health issues?
Ma'am, at the level of medical education first, I would start. So at the level of medical education, the NEET system has definitely brought in rampant changes. But as we pursue the MBBS as well, there is a plethora of seats in the southern states for MBBS, while in the northern states, there is definitely a deficiency of seats. So this being the case, there is a dearth of healthcare professionals again in the northern sector as compared to the south. So this is one rampant challenge that we've been facing in recent days, and the NMC has brought in a change of starting a medical college only in case there is a deficiency of doctors in that particular state. So this would be the first challenge that I would see. The second challenge being, even in case of doctors, we have a dearth of doctors in PHCs at the primary healthcare center level, especially in the hilly and tribal areas, and that I would probably attribute more to the issue that, one, the medical recruitment boards in different states have conducted the exams but have not been able to give the postings. So that is one. The second thing being, even though when they've been given the postings, they've been given it more or less in hilly and tribal areas, which still seem to be a lot more inaccessible. So that is again a problem with doctors being able to go there. The third thing being, in spite of them being going there, again, there are more medical conditions wherein they will have to give a referral to the secondary and the tertiary healthcare sector. And that being the case, more of the patients, especially during COVID, we had a huge load of patients being shifted to the secondary and tertiary care hospitals, including our government hospital. So even in spite of doctors being there, there is again a need for specialists and super specialists at the secondary and tertiary care level. So these are three issues which would come in case of the doctors being, I would say, sparsely populated in different states. And the third issue with respect to hospitals, again, is the cost of medical care. Even though the PMJAY and the CMCHIS schemes have been able to bring in rampant change with respect to the affordability of hospital care services, the problem being that a large population of the private healthcare hospitals have still not enrolled themselves into the CMCHIS and the PMJAY schemes. More so because they might have a delay of payments, or maybe for best reasons known to them. But then for even in spite of these reasons, private hospitals have not enrolled, and they don't let the private patients to opt for such schemes either. The fourth is the problem with awareness of the general population about health insurance schemes as such. If it were the case of the USA, wherein health insurance is a compulsory tool and where Medicare and Medicaid is the norm of the day, but that is not the case with respect to our country, where vehicle insurance is compulsory but health insurance isn't compulsory. So this is again a problem wherein we never know when a person might get into a health ailment and might run into a huge expense. The fifth issue I would like to point out is with respect to the device of the schemes, wherein the schemes have made a income control of say 3 lakhs, of which say even a person with 3 lakhs 1,000 might be avoided from the scheme, and he might be eliminated from the control of the scheme. So in such case, a person will have to go to a private hospital and spend money out of his pocket. The out-of-pocket expenditure runs to 48% as per the National Health Statistics. So these are the 5 problems I would like to point out, sir, with respect to the health system in our country.
And how do you overcome it?
So with respect to the device of schemes again, just as how the private hospitals have been given the point to opt in or opt out of the scheme, I would like the government to promulgate a system wherein the private hospitals are ensured due payments in due course of time, so that they opt in for the scheme voluntarily. And even otherwise, every private care hospital can probably be made to opt for one of the health insurance schemes, either be the state government CMCHIS scheme or the union government's PMJAY scheme, which is again integrated. But at least one of the schemes, if the private hospitals had to integrate, then it would definitely help a larger section of the society. This is one, sir. And with respect to the second thing being wherein the primary healthcare centers have a dearth of medical recruitment doctors, The medical recruitment boards in most of the states have conducted the examinations and they've not been able to give the allotments. So in such a case, they can give the allotment orders at the prompt time, wherein, say, a limit of 3 months or 6 months can be used and to give the allotment orders, and that way we will be able to save the doctors from pursuing alternate professions or alternate hospitals. The third thing being, the NMC again has promulgated a system wherein they've curbed the medical seats in states where there is a surplus of MBBS seats. Like our Tamil Nadu government has given the system of one district, one hospital, and one medical college. But the NMC has brought in this system to curb that, more so because when there is a surplus of doctors, it becomes tough for them to pursue PG and to pursue super specialty seats, because PG and super specialty are again given based on the ratio of UG seats. So that being the case, we might have a surplus of doctors over here, while there is a dearth of doctors again in the northern states. So to eliminate this, NMC has brought in this system, and in my opinion, I feel that what the NMC has brought in might help with respect to the long run. So these are my suggestions, sir.
How can we say, for example, you said the problem of doctors in remote areas, not sufficient doctors. So how do you think technology can be used to solve this problem?
Yes, sir. Especially in remote, inaccessible and hilly terrains, our government, the union and the state governments have brought in the system of 5G, which is being spread across the country, and slowly it is being brought into the village and rural areas as well. So since 5G has a very poor latency, the Medicare setups can be taken into e-governance, and it would be probably easier to take up online consultations, online referrals, and even the e-Aushadhi scheme of the union government has been brought in, wherein pharmaceutical supply has been made online available, and people will be able to just upload the prescription and get the medicines delivered doorstep. So this will definitely help in avoiding referrals to the tertiary care centers, except where.
When you talk of suggestions, you should also look at how to use technology to overcome the problems.
As Sir pointed out, Dr. Prasanth, in terms of cancer, there is therapeutics and diagnostics. Now there is a term called theranostics.
Yes, sir.
Very well.
Sir, I have heard this terminology, theranostics, wherein they kind of reconstruct the system and check how they would fare in the future. It is a combination of the diagnostic and the therapeutic components, sir.
Yes.
They give the therapy, in case they give the therapy, how the patient would fare is checked.
So in terms of cost, these theranostics, now we could cut the reduction cost in treating as well as curing the cancer.
Yes, sir.
But we have an array of disorders, not only cancer. If you take the Indian population, we are more diabetics. What government has planned to control the diabetics?
Yes, sir. So for the union government has brought in the scheme of National Program for Prevention and Control of Non-Communicable Diseases, which includes diabetes, stroke, and cardiovascular diseases. So under this scheme, the patients have been given free care for diabetic checkups, especially in case of antenatal mothers to diagnose gestational diabetes mellitus. And anyone above the age group of 45 years has been given the option of opting for a master health checkup to screen themselves for diabetes. So there is a concept of screening time and the lead time. So this being the case, the lead time is reduced this way using the screening time, and the patient is able to avoid consequences that the patient might incur due to chronic diabetes. And then for the foot ulcers as well, which diabetic patients are prone to develop, the government has again helped them in taking up reconstructive surgeries by establishing a department of plastic surgery and reconstruction surgery in every tertiary care hospital. So that will again help them to take up diabetic foot care, and also MCR slippers are being provided free of cost by the government, sir.
So in terms of diabetics, there is no doctor need. Now dietitians are coming in picture and they are diagnosing this disorder. So what is the role of doctors now?
Sir, the role of doctors does not end with the role of diagnosis, but it also helps in the prognostic component and in the component of avoiding complications. Every patient who is screened and diagnosed of diabetes mellitus needs to also be checked for the complications of diabetes. be it type 1 or type 2 diabetes. And type 2 diabetes probably might be easy for a dietitian to recognize just based on the sugar values. But then in case of type 1 diabetes, it is also imperative that they diagnose the complications, because the younger age group is where we diagnose type 1 diabetes, and they are prone to developing complications of diabetic ketoacidosis and diabetic coma as well. So that is one thing which is important, sir. And again, in the complications for type 2 as well, there is diabetic retinopathy that we need to screen for, diabetic nephropathy that we need to screen for, which a dietitian will not be able to do.
Like your grandmother died because of cancer. My mother died because of diabetic medicines she took. She took dining.
Yes, sir.
Just because of her calcium deposits has been gone, and because of that she became weakened. Not because of the diabetics. The medicines she took weakened all the calcium deposits, and she died because of that.
Sir, the diabetic medication again has a side effect to it attached to it as well. And the side effects again could be, as you mentioned, sir, hypocalcemia, or it could be more commonly it is hypoglycemia, which the patients are prone to incur. And that is where the role of a doctor comes in titrating the dose of the medicine appropriately. And regular checkups in the form of a CBG, which is a capillary blood glucose monitoring, will help in detecting the low sugar levels or the high sugar levels, as the case may be.
No, the Daniel comes with 250 mg. My mother is hardly 48 kg. But how do you prescribe that medicine? 250 mg is a overdose.
Yes, sir. The dose can be titrated based on the kilograms of body weight.
No, the pharmacopoeia doesn't have that.
So
whatever you buy, either it comes with 250 mg or 500 mg. Either the doctor prescribe the higher dosage or sublethal dosage, that ultimately it causes all the damage, liver damage, kidney failure, all the adverse effect. The pharmacological mechanism is not elucidated properly.
Yes, sir. There could be two things in this, sir. As in my suggestion as a doctor, one, that Dianel is generally given twice a day or maybe thrice a day, depending on the sugar levels of the patient. And as you said, sir, it comes in formulations of 250 and 500. So that being the case, say if 750 mg was supposed to be given over a day, depending on the body weight, say if it was 48 kilos, let's assume it is 50 kilos. So if it is 50 kilos of body weight, 1.5 mg per kilogram, so it comes to 750 mg. So putting
Do you believe in alternative medicines?
So alternative medicines again have helped a certain set of patients, but it again depends on what the disease condition is and what the formulation is that is being given in the form of alternative medicine and the person prescribing it. Ayush again is a course of 4.5 to 5 years, and people who have practiced Ayush and who have the knowledge of the medicines that they are prescribing have definitely been able to show results at least partially. But there are quite a few quacks who again practice in the name of Ayush and demean the system as such, and that is where I believe the role of Ayush has gone down, sir.
You mentioned something about bioethics in your leadership qualities. You're mentioning about bioethics. What is that ethics in your medicine?
So, pardon,
ethics applied in your medicine.
Yes, sir. So, one, I would start again from the medical education perspective, wherein we have something called the AETCOM module, AETCOM. And this is the Applied Ethical Training module, for communicative module. And this has been prescribed by the NMC, again to inculcate ethics in our field. So on the question as to what ethics again exist in the healthcare field, one is to avoid the dichotomy that exists between the medical field and the medical representatives. It could be the pharmaceutical companies or it could be the diagnostic laboratories. It is an established fact that there does exist a dichotomy. And in spite of the NMC bringing in rules to regulate this using the ethics...
No, one simple question. You studied in Madras Medical College.
Yes, sir.
Do you have a clinical trials there?
Yes, sir. We do have clinical trials which run there.
So, which phase of the clinical trial?
So, clinical trials have 4 phases from phase 1 to 4. And until the phase 3 aspect, it is more on the lab rats and the other animals and such. Post 4, the phase 3 is as such the human clinical trial, and the phase 4 is the post-marketing trial, wherein the particular medicine is supplied in the commercial field and we see for adverse drug reactions. But the medical doctors are not directly involved in the clinical trials. The case being that it is more of the pharmacology.
Yes, there is some guidelines in terms of human trials. You should follow some guidelines.
Yes, sir.
What ethics behind it?
So the first in human trial guidelines is to establish that there is a efficacy which has been seen in the phase 1 and the phase 2 trials first. The phase 1 and phase 2 trials as in the as in the lab rats and the mice and the other lower order animals. That is the first thing. The second thing is to take consent from the patient on the clinical trial as to what they are going to do in the clinical trial and how the patient will be used, as in it could be a placebo or a nocebo effect, and if they are being administered the tablet as such, or if it is the placebo effect, as in give a random tablet and tell them that it is the particular drug which has caused the disease, or which has alleviated the disease rather. So that is the second part of the consent that we need to take. The third is with respect to the expected adverse drug reactions that the patient might incur, be it with respect to even loss of life that the patient might incur through. So all these need to be explained both to the patient and to the immediate relatives, and the consent be taken on paper and off the record orally as well.
You are aware of OECD guidelines?
Sir, I'm not aware of the OECD guidelines on ethics, sir. I only know what the
Organization of
OECD
Economic
is.
Cooperation and Development.
Yes,
It's an
sir.
international body.
Yes, sir.
Now they have set a set of guidelines to follow in human ethics, animal ethics, and all bioethics. should
Okay, sir.
follow.
Sure, sir. I'll read
There
upon
will be
it, sir.
minimal model number where you could subject to evaluate or eradicate the adverse effect of any clinical trials.
Yes, sir. I'll read upon that, sir.
All the best.
Thank you, sir.
I have just two questions. Number one, Prasanth, you've been involved with drug de-addiction, the
Yes,
NGO.
sir.
What was the one key learning you saw, observed, and you felt, this is my first question is, why did you opt that to go there, and what was the learning there?
So we did this in my third year of MBBS
Right.
in one of the government schools at Troyapuram, sir. So it was actually the headmistress's request to ask the medical students to involve themselves in getting a drug de-addiction drive done. More so because the drug mania has been rampant in that area, especially in the school-going children of that particular school, which the principal had noticed. So she had taken it to the notice of the police authorities as well, and to the notice of the fellow doctor community, so that we will be able to educate the students better and nip this in the bud. So that is when we did it in the form of a play, or a skit rather, a group of 10 of us. So that was more focused towards the tobacco addiction, as in the smoking addiction, the alcohol addiction, which is again rampant, and the opium products. It could be morphine or heroin, that we wanted to bring it to the notice of the students as to how it can adversely affect their health, and not just their health, but the family as such. So the key learning experience that I had from this was that, like, it was not something that I had known, that even school-going children of this particular age group on such huge numbers were rapidly addicted to such life-killing drugs. And the second thing being that more of them had been addicted more so because the family members, as in they had seen their adults doing it. It could be smoking or alcohol, which they had seen. And that parental behavior definitely influences the nuances that the children learn from their parents. And that being the case, it is definitely essential that parents monitor the activities of the children, especially the teenage children, and parents themselves be role models to children in inculcating good practices.
Do you think the phone addiction also will come under this context? Phone is also an addiction, right? Though
Yes,
it's got
sir.
a positive side. Mobile, especially with the kids.
Yes, sir.
Would that be considered addiction according to you?
So, according to the DSM-5 criteria, which is the Diagnostics and Statistics of Mental Disorders, the mobile phone addiction has been brought into the category of DSM-5 as a psychiatric disorder which needs to be curbed. And mobile phone addiction again has categorizations based on certain scales. One being that any usage beyond 6 hours per day is considered addictive as per the DSM-5 criteria. In my opinion, again, since Sir had asked, the mobile phone addiction is a form of addiction definitely, and that needs to be curbed, again, depending on what effect it has on the particular individual. If it is a psychiatric effect that it has been able to produce, say a low attention span or a loss of cognition or memory, then probably that is something reversible with behavioral change and behavior change communication, as we call it. But then if it has been able to bring in a physiological or a physical issue with the particular person, say it could be obesity, which we say is more due to inactivity, again due to playing of video games in our mobiles, or being again on the mobile, and again it again has a radiation risk as well attached to it. So if it has caused a physical issue, then probably we will have to give according to it the same therapy, so that mobile phone addiction can be curbed, sir.
Just to join with you, since you mentioned opium addiction, it's only a dosage matters. The tolerance and dependence of the person, based on the ability, it could be avoidable.
Yes, sir.
But as a medicine, it's a very good painkiller.
Definitely, sir.
Isn't it?
Yes.
Now we are prescribing this marijuana
Yes, sir.
for Parkinson's.
Yes, sir.
Like that, opium is a wonder drug.
Yes, sir.
But depending on the same way, as sir asked, the cell phone, tolerance and dependence. We made a dependence towards this gadget. Like that, a drug dependence, a kind of dependence, now we create addiction. That is the ultimate addiction.
Yes, sir.
So it could be avoided.
Yes, sir.
We could avoid this gadget and we could avoid even the addictive drugs we could take.
Yes, sir.
But there is any anti-nociceptive, that antagonistic
Yes,
drugs
sir.
available?
Yes, sir. For morphine addiction, we have something called naltrexone and naloxone. So that is something we give for opium addiction, sir.
Okay. Yeah, thanks.
So, Prasanth, you have been answering a lot of questions with regards to medicines and all. Yeah, I would like to switch gears.
Yes, sir.
What is your viewpoint on the Israel-Palestine war that is going on? Israel-Hamas war that is going on? Tell me.
Sir, with respect to the Israel-Palestine war that has been running, my perspective on it would be that the principles of war and ethics need to be adhered to in the first case. Like, it depends on whoever is right and wrong. That being the second issue, human lives matter the most. And for the cause of the world and for maintaining peace and for it not developing into a third world war, what is more essential is that two sides come to the table and discuss what issues could be sorted out on table, and off the table they could probably mediate it through the organizations such as the United Nations. And the second thing being, small lives, be it children, hospitals at Gaza have been affected very badly, and patients who have been on life care supporting services have lost their lives as a result of the war. And ultimately, what is most precious is human life, and nothing is above that. So that being the case, the both sides can go for a ceasefire and talk issues out, like with priority to the healthcare services to the elderly first, and to the young infants and children who have been taking up medical care, and the adults again can be evacuated to safe areas and continuing with their medical services, sir.
What do you see is the future of this conflict?
Sir, the Israel-Palestine war has seen both sides not having nudging their positions and being firm and hardcore on their issues, with countries lining up such as the US on the Israel side, or probably the Arabic countries on the Palestine issue. And that being the case, this could, if not curbed at the right moment, it could probably develop into a third world war sooner or later, and that is what all the countries fear for. And at this point, it would be better that we settle the issue as fast as possible, sir.
You really think it will go into a third world war?
Sir, provided that already the Russia-Ukraine war has been going parallelly, and then it has been the Israel-Palestine war at a time when no one even predicted that such a war could even come up. So this being the case, a third country again might go into war with some other country for reasons best known to them at any point of time. And this is something that is unpredictable as well. So that is where I believe the point of peace and organizations such as the United Nations come into.
Okay.
Thank you, sir. Thank you. Thank you, sir.
We found that you have answered all the questions very well. Your confidence level is good. You are expressing well. So please continue your preparation, attend more
Yes, sir.
mock interviews, prepare well. Of course, today's discussion went mostly on subjects, on medical science related
Yes, sir.
subjects. But you should also be prepared for other topics also.
Yes, sir.
So you continue. So one or two observations which my colleagues also told me was that you have to wear your tie properly. You have to.
Yes, sir.
In UPSC, I think coat is optional, but you should wear
By the
tie properly.
Yes, sir.
Then we also felt that you could give a little more concise answers
Yes, sir.
instead of very elaborate answers. A little more concise answers, which would immediately strike the person
Yes,
who's conducting the interview. But otherwise, you have answered all the answers, all the questions very well. You had anything else? Yeah.
Sure.
So prepare well. I'm sure you will do very well.
Yes, sir. Thank you so much. Thank you.
All the best.